Ladies and gentlemen, dear colleagues, welcome to the follicle fantastic event of the year. I'm really glad to be here with you today because it's a really special day. Today we're going to be speaking about men's health, which is at the core of what we do at the urology division. So I'm really happy to be with you here today leading this event. Today we're going to be diving a little bit deep into the hairy details of Movember. So that people who doesn't know, Movember was created...
Don't say
Quickly.
Don't
You have-
explain the word November.
Okay. So I'll leave Movember explanation to Dr. Fari Boris. And today and now we're going to be having a really great time with one of the most well-known key opinion leaders in the region, a great consultant urologist and a great friend of Boston Scientific as well, to be walking through the men's health in general and the secrets of the prostate. So I'm really happy to be here today, and I hope you enjoy this talk, and hopefully it will be more captivating than a Netflix binge, minus the guilt. So I'm happy to give the floor to Dr. Faribors to start his presentation, and then we will follow that with questions and answers. And right after that, I'll make a quick presentation about Boston's solutions for BPH. Thank you, and I hope you enjoy it.
Thank you very much. Thank you. Good afternoon, everybody. You hear my voice? So please control how you want. Like this or like this. Which one is better? Number one, number two. Number two, I think is better, right? Okay. I really appreciate Boston Scientific. This is the second time that they have invited me. I was in your office, the old office, 2 years ago in 2021. When they invited me, I thought that it is last year, but how fast the time is going. The second thing, I'm very, very happy that last time when I came, I joined, I had to pick the... I have to be here. Wait, that's the camera, okay. So I have to pick that ladies also join us, but here I can see that more than half of our audience are our sisters, and that is a great thing, and I can see that they came even before the men. And that means a lot. Thank you very much for this. The reason why I start Muhammad of explaining about Movember, because I have a small surprise for you, and the surprise is that I will ask what is Movember, and you answer, and who has the best answer, he will get a gift from me. And this will be the gift from my side, which is one of my favorite books, which I read about 30 years ago, and I strongly recommend all of you to read this book. It's not an advertisement. I don't know the writer, but it is a great, great book, and you will see it, inshallah. So what is Movember? Who wants to join me? So I can't go more further. I want to go Okay, so you can take this. So what is Movember? I need the best answer.
Me.
Please.
Mo for bro.
Means you need to do a mustache for your bro.
My mic is not working. So mo for bro means you need to grow a mustache. If you're a man, not for ladies, I hope. To support the men's health and men's health awareness amongst all of us, to support their well-being.
Okay. Anyone else wants to comment? Please.
What you said plus prostate cancer, so the awareness for prostate cancer for men.
Prostate cancers. Anything else? Nothing. So I think if you don't mind, we'll give the gift to her, and the reason is that
Thank you so much.
Thank you.
What is it?
Thank you.
What is it?
Let's set this surprise. Let's set this surprise. And in addition to this, what we'll have, I will ask you a lot of questions during my nearly 1 hour presentation, and the one who will answer more better answers, you will get points. So I give you points, and the one who will have more points, he will get the second gift, which is the same thing. Okay? Clear? So Movember actually started in 1999, and what happened in Australia, a group of men, about 30, 50 men, got together and they put mustache and they said that let's have mustache on the month of November in order to raise the awareness of men's diseases. You said prostate cancer, you said men's, when they discussed about the men's diseases, they mean a lot of things. Not only BPH, not prostate cancer only, but a lot of other things that if you don't mind, all of us are above 18. Let's open the subject today and share the knowledge together and discuss about everything that we want to discuss freely. Any objection for this?
Music
No.
to my ears.
Sorry?
Music to my ears.
Can we proceed? No problem?
Sure.
Sure. So, I had a slide. Actually, this was interesting. I would like to share with you, and you can, if you want, you can also join me if you want. Almost about 3 months ago, until 3 months ago, I was completely against having any social media. Completely against. And I didn't have anything. I had only WhatsApp, and that's it. Then my friends came on, my wife, Dr. Ilham, and Mr. Taghi, they encouraged me, let's do something. I said, well, I don't want to do something because I don't want to advertise myself. That's not good, that's not me. But it is in my spirit that always I love to have public awareness. And I will show you what I mean with this. I said, okay, I'll do that, but only for public awareness. And thanks God, so far we have almost about 32 videos. And every 3 days, we have one clip of almost 30 to 60 seconds. You can listen to it, and I can promise you, if you go continuously with me, after maybe 2 years, you can get your urology diploma as well. So, this was a video that we shared at the beginning of actually it was a video, but now the video is not recorded here. We shared it in the Instagram, and in this video, I had the same question that I had today, and also 3 of the people who joined us got the same book, and I brought you today 2 things. I would like to have some warm up with you, and this warm up already we discussed about the meaning of the November. So, what is public awareness in general? When we discuss about public awareness, what does it mean? What it is for? Is it to scare people? Is it to bother people? Is it to make money? Is it to increase number of patients in the hospitals? If any of these, that's wrong intention, and you will not be successful. Honestly speaking, none of this is my intention. So, what are the objective of any type of public awareness that we have? Any type of public awareness in medicine, in my opinion, is to raise public information about health. How to do that? One is how to prevent disease. Very important. And the second thing is early detection of the disease. So to know when there is a disease. Avoid embarrassment. One of the problems that we have here in Dubai, especially in my specialty, is embarrassment. We have a lot of patients, whether man or woman, who don't come to us. Many times we have to ask when they come due to any other reason, whether they have, for example, premature ejaculation or not. A woman, whether she has urinary incontinence or not. We know that a woman above 40 years of age, at least 30 to 40% of them may have urinary incontinence, which easily can be treated. And we do know that men of any age, above 25 years, any age, may have premature ejaculation, which is a disaster. And 25% of men have disease, and this is also treatable. So we ask the patient, please don't be embarrassed. The second thing is to seek doctor in time. Many times, say, oh, we'll leave it, we go next time. No, seek in time. Because if we detect the disease in time, its treatment is also much easier. And accept the treatment. Accepting the treatment is very important. When I came here, one of my problems was that what to do to convince the patients that, come on, this is, what I'm saying is for you, it's not for me, I don't want to make money. I was working in public hospital, so please accept it. Give me a medical report, I want to go abroad. So creating the doctor-patient relationship was one of my first challenging things that I did in Dubai, and alhamdulillah, I was very successful in this. And the last thing, which is also important in my opinion, avoid unnecessary medical tests. You know, many times there is something which is called PSA, prostate specific antigen. That's a test which we do usually for screening of the prostate cancer. A 20-year-old man comes, please do PSA, because Dr. Faibor said PSA is needed for screening of prostate cancer. Come on. Unnecessary test is not necessary, and we'll discuss what we mean of this. So this is the reason why we have a lot of types of awareness worldwide for in the medicine, and one of them is prostate awareness. Today I will try to join the prostate awareness with other issues of the men as well, in order to just tell you what I mean or what I started at the beginning. You know, I was the first who started, I joined Dubai Hospital, DHA, in 2010, and then started the first Dubai Prostate Awareness Day in 21st of September 2011. We had a lot of brochures, and then in 2012 also we did similar thing, and we had a lot of gifts at that time. In 2013 also we made it with Sheikh Hamdan's award department. It was very nice. We did a lot of activities at that time, and this continued for a few years. Unfortunately, it did not continue in the past few years, but I would be very happy with some support from other companies, inshallah, to continue this, and there was some reason that we had to stop it. So why prostate awareness is important? Before going to this, I would like to ask what is a prostate, but before going to prostate again, I would like also to ask what is urology? What do you think? What is urology? Go to video number.
Here, you're asking the wrong gentleman. There is a gentleman.
No, don't come to me. Don't come to me.
Where is my circle? You should have made a circle for me. Where I have to be is that so they can see me.
Yeah.
Only here, yeah? Only here. You can sit here. Okay, I cannot sit there.
Your mic is off.
Your
My
microphone
microphone is
doesn't
on.
work.
Is it on?
No.
Oh, okay. So, what is urology? If you go to video number 3, I think, right, Fardeen?
Yes, number 3.
Video number 3 in the Instagram. So, a lot of patients even don't know what is urology. You know, it's very simple. I will show you this picture. Urologists deal with both men and women. We have urinary tract, which is kidney, ureter, and bladder, and both men and women have these organs. So urology deals with these organs, any disease of these organs, cancer, whatever, incontinence, stones, and so on. In addition to this, we also deal with the reproductive system of the male, which is prostate, seminal vesicles, testes, and so on. So this is urology and urologist. Very simple. So, question, no, please, as I said, embarrassment should be put aside and you should win the gift, okay? So, the question is, do you know that most common health problem in men is hypertension, increase in blood pressure, diabetes, cardiac disease, sexual dysfunction, or prostate disease? Muhammad Jabir.
Cardiac disease.
Muhammad Jabir's opinion is cardiac disease. What's your good name? Hani?
I would say prostate disease.
Prostate disease. Okay. Honey, you get 1 number. I don't know the number. So I'm giving you a number that I don't know the number, okay? So, believe it or not,
You feel okay?
believe it or not, prostate disease is #1 among men. And how about the most common urological diagnosis? So I said what is urology and urological diseases. What is the most common urological diagnosis in men less than 50 years of age, like myself? Kidney stones, sexual dysfunction, prostate inflammation, prostate enlargement, or prostate cancer.
Prostate enlargement.
So prostate enlargement. You said something?
Same.
You said same?
Probably so correct.
Prostate cancer.
Prostate cancer?
Prostate cancer.
Prostate cancer?
Sexual dysfunction.
Sexual dysfunction.
I think enlargement.
Prostate enlargement.
Maybe kidney stones.
Kidney stones.
Prostate inflammation.
It's good to know that below 50, prostate inflammation is very, very common. About when the patient comes to our office, when he sits, almost from the beginning, my before even he sits, I will tell my assistant, write diagnosis prostatitis. How you know? I know from his shape, age, and so on.
What is it? What is
We'll discuss. Very good. So, most common cause of voiding problems. Voiding problems means that there is problem in urination, problem in pee. Okay? What is the most common voiding problem in men above 50? That was below 50. Is it bladder stones, urinary tract infection, nearly similar questions?
enlargement?
You should get one. You should get one. I don't see the number. I don't see the number. Exactly. So it is prostate enlargement. So above 50 years of age, prostate enlargement is the most common issues of the voiding problems. Most common diagnosed cancer in men. You think which one is it? In general, not only urology. Is it lung cancer, colon cancer, bladder cancer, kidney cancer, or prostate cancer? I want one raised hand. Prostate cancer. So, prostate cancer is the most common diagnosed cancer among men. Believe it or not, 1 out of 8 men, so how many men we are here now? Let's say 20, at least 3 of us will have prostate cancer. But don't worry, please, there is treatment about it. So what is prostate gland? All men in any age may have, as you saw from so far, may have some types of prostate diseases. Correct? Clear? Now, what is prostate in general? Prostate is a complex gland. It is situated, as you see in this picture, it is situated below the bladder. This is the bladder, and here is the prostate. Here are the kidneys. So prostate is an organ which is situated below the bladder, and its function are generally 2 things. Oh, yeah. So it's where the function is not here. The function is not here. So its function in general are 2 things. In general, one is producing semen. Don't confuse with the sperm. Where the sperm is produced, the sperm is produced in the testes, then it transfers to the nearly prostate, and together with the semen which is produced in the prostate and the seminal vesicles, it will be excreted. Okay? And the second function is that, what is the second function? If you think this is the prostate, there is a lumen in the middle of the prostate. And through this lumen, the semen and also the urine will come out. And this is the reason why, if there's any problem in the prostate, whether it is prostate enlargement or prostate inflammation or prostate sometimes cancer, advanced cancer, it can cause problem in the urination, in pee. Very clear, right? Now, what is normal prostate size? Is it 20, 25, 30, 35, 40? What is the normal prostate size? I want to give you one gift.
No comment.
I think no comment.
No comments. 30?
25.
Okay?
For me, it's 40.
You have a problem. كلمة كبرت.
How did you measure?
25.
What is the normal size of the prostate? 25. Well, who can tell me?
20.
Okay, so I will not give any of you. No comment? Okay, they voted for you, they like you so much. She said, they like you so much.
Will you
So,
sell it?
prostate size, they are the same as if I tell you what is the normal size of hair. You understand my point? What is the normal color of hair? It's almost the same question for me. Okay? In general, conventionally, we say that normal size of the prostate is about a walnut size, which is almost 20 grams, but with age, the prostate also can grow. Clear? With age, the hair can be white. So it's a similar thing, and that's not a disease. That's not certainly a disease. Okay? So all of those numbers which are written there can be normal depending on the age. Okay? Now, what is the prostate function? We discussed about it. Now, what are the prostate diseases? Already you know the answer. What are the prostate diseases? You want to name them? Or you don't have. Very good. So prostate diseases can be inflammation, enlargement. Please keep these papers, give it back to me because I need it. It was very difficult to make them, huh? And I need it for my next presentation, inshallah. So, the prostate diseases in general are three things. Very, very easy, right? Inshallah, when you will go out from here, say, yes, I know urology. Prostate inflammation, which we say is mainly among the young men, prostate enlargement, which is benign, and prostate cancer. What is prostatitis or prostate inflammation? It is a swelling of the prostate gland, a swelling of the prostate gland. In which age it may happen? It can happen most common in adolescents and young men, as you see here. And what are the causes of prostatitis? How it caused? What we say to prevent, right? If you know the cause, then prevention also will be very easy. Bacteria entering the prostate through the urethra, very easy. Let me openly tell you, if a man is sitting in a toilet, for example, and the previous man had an infection, then that water will come up toward the urethra. There is chance that through the urethra, infection will ascend, go up, and cause infection. Clear? And many other things which I don't want to go into detail. Clear, right? Now, the other thing is reflux of the urine or semen. What does it mean? If you hold urine for a long period of time, you're sitting here, you want to pee, but you don't go. That's wrong. Okay? Because this will cause reflux. We have 600,000 of ducts in the prostate, and this reflux gradually can cause inflammation. The same thing for the semen. How? There are a lot of men who have bad habits. For example, they want to come, but they don't come. They stop themselves. This also can cause reflux of the semen, and reflux of the semen also can cause problem. Next, and the most important thing, is the so-called semen congestion. What does it mean, semen congestion? We said that the prostate gland produces semen, right? So, probably most of you have experienced that we had something which is called what? Night dreams, right? Night dream is not because, because you had sexual desire. You didn't have sexual desire. You know what I mean, right? Yeah. Night dreams during your young age. So night dream was not because you had sexual desire. This was a gift from God, because the prostate is producing, somehow it has to be excreted. And you dream something at night and excrete it. You understand my point?
Yeah.
Now, let's go.
I'm looking at Hassan. I wish I would go to the old back days.
Now let's go a little forward. This was during your teenager. Now let's suppose you have sexual desire but you don't do anything. You will have the same problem. Is that my point? I always tell my patients or my friends, you should have a balance between desire and sexual activity. That is very, very important. Otherwise, this is the same as if you have congestion here, right? If you have congestion here, you may get sinusitis, correct? You may get difficulty in breathing, correct? If you have congestion in the semen, you may get prostatitis. Very, very easy, right? And we say also unknown causes. There are some unknown causes as well, but this, the third one, is the most important thing, but the correct answer is, as we said, is all of them above. What are the symptoms? So, for prostatitis, or prostate inflammation, we have different types of symptoms. As you see here, I will go one by one. If it develops, see, this is, in most of the cases, is chronic. Chronic means lasts more than 3 months, sometimes for years. I'm 100% sure, I will not look at you because you may smile and then I know who is that. I am 100% sure that 25% of men who are sitting here have chronic prostatitis.
Can you say anything?
You got my point? And it's easy to treat, please. Very easy to treat, and this is the reason why we need understanding, and this is the reason why I'm happy that all our sisters also here, because understanding of this topic is important in order to help each other and to have a healthy, safe couple relationship. So, if it develops gradually for a long period of time, it can cause back pain. it can cause also pain in the buttock when especially you're sitting in a hard place. For example, like this chair.
He's facing back pain.
tell me that he has back pain. That's no, he doesn't have.
No, I have neck pain. Is it related?
Neck pain because we cannot sit, maybe that's Next, you may have pain also in down area. You may have pain in the lower abdomen as well. You may have urgency in urination. You know, every 5 minutes or 10 minutes, or let's say even half an hour, you have to go to the toilet. So think in such situations, there should be something. You may have problem in sexual activity and distress, and that is a big issue. And you may be depressed, and this will cause problems in the couple relationship, and also it will have impact on quality of life. See guys, we are talking about very simple thing, with simple diagnosis and with simple treatment, but believe it or not, it has very important impact on the quality of life of not only the man, but the woman as well. So let's hit the goal. We said to prevent the disease, right? This is the first goal. We have to prevent the disease, correct? So for this, how to prevent it? We discussed about the causes. So bacteria entering the prostate. Whenever you go anywhere, be very careful, nothing to enter up. Very important. Reflux of the urine. Please pass urine whenever you feel that your bladder is full. Don't, stop. If you want to ejaculate, ejaculate. Semen congestion. If you look at video number what? I think it's video number 22, I think. If you ask me, give us two advices from urological point of view for men's health, I would say, video number 21 he's saying. I would say that 1, drink adequate water per day, and the second, do adequate sexual activity, safe sexual activity weekly. And if you want to go into more detail, we can go. Yeah. And if you ask me what does it mean, I would say that for your age, all of you are here around between 20 to 40, I think. So I would say at least 2 to 3 times per week. That is really needed for a man. Okay? So the second thing we said that early detection of diseases. I think now all of you could detect what you have or what your friend or your partner may have. Okay? And with these symptoms we discussed, very easily you can know what is the issue, and please, if you cannot treat yourself based on the advices that we mentioned, avoid any embarrassment and easily go to seek a doctor, and that doctor is a urologist, who can have a good diagnosis and treat you. For the treatment, I don't want to go into detail because from this moment probably you will go to the doctor, and we have a lot of ways of treatment. One is medication, and many other things which I will not go into detail, just I will show you a few pictures. Antioxidants in general is very good for anything. Okay, so this is not a special for the prostate. A lot of patients ask me, what food is good for prostate? There is no food which is certainly we can say good for prostate. When we say these things, like this one and like this one, all of these are good for everything. Prostate, kidney, I don't know, lung, and whatever. Correct? Looking now? Now, the second thing which is important is, as we mentioned, whenever you want to pass urine, don't stop, go and pass urine. The other one, we call it sitz bath. What does it mean, sitz bath? Prostate doesn't like cold weather. If you're sitting, for example, here in a cold environment, then it's better at least to have something below your chair which warms the prostate. Okay, many patients tell me, okay, can I go to sauna? Well, no need to sauna. Even 2 centimeters warm water and sit. If the buttock, if the anus is inside the warm water, it means that the prostate is inside the warm water. 15 minutes per day, excellent treatment. If you ask me what are the 2 most important treatments for chronic prostatitis, which means chronic inflammation of the prostate, I will tell you 2 things. 1, increase sexual activity, safe sexual activity, and health. And second one, I will tell you, sitz bath, warm water. Okay, clear? So, accept the treatment that I mentioned and avoid unnecessary medical tests. Patients may come, sorry? Okay? Patients may come and tell you that, well, doctor, do for me MRI. No need for MRI. The diagnosis is very clear. What we discussed, don't do and don't push the doctor. Doctor, do me a STD test. You know how many times patients come to me and they pay 3,000 dirhams to the hospital? I don't want that money. And they do STD test. You don't need it. This is disease.
Sorry, what is it?
It's sexual transmitted disease test. Sexually transmitted. So he comes with similar symptoms. He's afraid that I have issues. With 2 questions, I can answer the question, the situation, and I can decide whether you need STD test, 2,000, 3,000 dirhams, MRI or not. Okay. So we finished this topic. How many minutes we have, Muhammad? 30? We have 3 minutes. Yeah. Huh? We have. Okay. So far clear? Yeah. Everybody's okay? Do you want to stand a little bit and have a rest? Stand a little bit, please. Stand. Thank you very much. Thank you. Okay, I know you can sit. Thank you very much. Okay. Can we continue now? So, the second part is benign prostate enlargement. Okay? Prostatitis finished, right? You want to ask any question about prostatitis? Avoid embarrassment, we say. Very clear, right? Any question, anyone? Good? Yeah, okay. So, prostate enlargement, what is it? Prostate enlargement, when we say benign prostate enlargement, means that it is not life-threatening. It will not kill. Okay? This is benign. It is common, especially among men above 50. I would say that more than 50% of men above 50 have some sort of enlarged prostate. Clear? 50. Does it mean that we have to treat all of them? No. You may face some situation that doctors tell you, yes, you have prostate 50 grams, come, I have to do flan and flan. No, not necessarily. We don't treat the prostate. Clear? We treat the patient. That's very important. And what I mean, whether you need to be treated or not. Do you have any symptoms or not? Unless if it is cancer. Clear, right? Now, as you see in this picture, this is normal prostate, and this is the bladder, and here we can see the urethra. This is enlarged prostate, and in this enlarged prostate, we see how much the urethra is compressed, as you see in this picture, for example. Of course, this can cause voiding symptoms. You may face some patients who have enlarged prostate, but without any voiding symptoms, and this is our duty to check. Okay, what kind of voiding symptoms? We have different type of voiding symptoms. I've showed a lot of things here, but in general, I'll tell you one thing which you will never forget. Okay, or colleague, they come back, yeah? I'll tell you a joke, and this joke is exactly what prostate enlargement with symptoms mean. Clear? A man was sitting in front of the ENT, in front of the ENT, right? ENT clinic. Sorry, in front of the urology clinic. Then his friend came to him and he said, "Excuse me, what are you doing here?" He said, "I pee the same way that you talk." Clear? So if you have hesitancy, it means you hesitate to initiate. Of course, none of you have this problem, I think, but your father, your elder brother may have. Okay? Usually these symptoms, these issues above 50 years of age. So what I mentioned, what is hesitancy? It means that you hesitate, to start the urination. Sometimes, it's interrupted. There is no continuous flow. So exactly the way that I explained. So all of these symptoms means that there is some problem with the enlarged prostate which causes voiding symptoms. Okay? Clear, right?
Yes.
Now, so what to do? We said that prevent the disease. Can we prevent benign prostate enlargement? Can we prevent prostatitis, prostate inflammation?
Of course we can.
Okay. Can we prevent prostate enlargement? always what I say, anything that you cannot change it, don't worry. You have two solutions. Either you know the solution, as we mentioned for prostatitis, and you solve it, already you know, or you don't know, there is no solution, so don't worry about it. Oh my God, I have a large prostate. Don't worry, okay? There is no way to prevent it. A lot of patients ask again, what kind of phenomenon? No way to prevent it, not to treat it, huh? Don't be confused. No, if you have such symptoms, you have to seek doctor, again, in time as we discussed, and for this, what I mentioned also, we always consider the symptom of the patient. In benign prostate hyperplasia or benign prostate enlargement, we look at the symptom of the patient. Of course, there are some more parameters. We look, for example, how much urine is remained in the bladder after complete empty. We check the size of the prostate. So there are some parameters that we have in mind. And based on these, we decide whether to put you on watchful waiting, which means nothing, or we give you some medications, or sometimes also we have some types of operations, minimal invasive procedures, and so on. Okay? And this is one of the operations that we do, which is called TURP, transurethral resection of the prostate. And if the prostate is too big, we can remove the prostate completely with an open surgery or with robotic surgery. Okay? So, what I would like to highlight here, one of the challenges again that I had, where are you from?
Russia.
From Russia. Okay, we don't have anyone from, also from Europe, yeah? From Poland. I was in Hungary and also in Austria and Germany for a few years, and as well in France. It was interesting, in Europe, it was very easy to convince the patient that, hey, you have this disease and this is the treatment. Very easy. 60 years old man comes and tell him, yes, you have this problem, and we have to do, for example, transurethral resection of the prostate. We have to remove your prostate. What will happen with this? It will cause infertility. Not erectile dysfunction, but infertility, which means that he cannot be a father anymore. In Europe, it was never a problem, but here's the problem. Please accept. If there is such issue, and we tell you that you need to go for operation, accept it.
So just a question, if you do so, it's you will have the same sexual capabilities, or?
Yeah, very, very good question. So we have, when we say sexual activity, which we'll discuss about it in a few slides after this, it's different things. We have desire, which is different. We have erection, which is different, and we have semen ejaculation, which is also different. So three different things. Libido or desire is whether the man has the desire towards sexual activity or not. Usually it depends on the psychological issues and on testosterone. The second one is erection. So you may have desire, but there is no erection. And the third one is ejaculation. So you may have a erection, but no ejaculation. There is no semen coming out. So these operations, or most of the operation of the prostate, not all, most of the operation of the prostate will cause either an ejaculation or decrease in the amount of the semen. Consequently, it will cause probably infertility, but no problem with erection. Now, so accept the treatment as we said, and easily you can go ahead. And that's it about benign prostate hyperplasia. You cannot prevent it. Yeah? Any question for enlargement of the prostate? No. The second hot topic is prostate cancer. I would like to highlight a few things that most common cancer death in men is prostate cancer. Don't be scared, please. I don't want to scare you. And prostate cancer usually, guys, doesn't have any signs and symptoms. We discussed about prostatitis, we discussed about prostate enlargement, and there were signs and symptoms. Prostate cancer doesn't have any sign and symptom. In most of the cases, more than 90% of the cases. If there is any sign and symptom due to prostate cancer, it is too late. Clear? So this is also important that why we are here. We are not even talking about you or you, we may be talking about your father or your elder brother or your friend, right? Now, how to do this? What to do? There is something which we call the screening. Internationally, about maybe 1 or 2 decades before this, we were screening a lot of patients, almost all patients, due to for prostate cancer with what PSA. Then we noticed that we are over-treating a lot of patients. And this is the reason why, unfortunately, nowadays we don't do screening, unfortunately, I'm saying, because I have different opinions. So our guidelines doesn't support the screening of prostate cancer in most of the countries. I don't like this. Personally, I'm talking about expert opinion. And why I'm saying this? Because we want to detect prostate cancer in early age. If we detect prostate cancer in early age, you can treat it perfectly. If you detect it in elderly age, it is either unnecessary to treat or too late to treat. Clear? And the second one is digital rectal examination. You know, our finger means a lot to us. That is an extra eye, third eye for urologists. And many times, and many times, you know, people like himself come to our clinic and we tell them, come on, we want to do this. No, doctor, no. Come on, why not? You know, we learn a lot of things from one finger. That can be rectal cancer, that can be prostate cancer, that can be prostate inflammation. So if the doctor tells you, I need this, and it's important, please accept, it doesn't harm you. If it detected early, it can be treated. So for the prostate cancer screening, there are a lot of things. The most important thing, as I said, is PSA and the digital rectal examination. PSA is a blood test, which means that you go and they take blood and they check your PSA. Now again, there are a lot of things about the normal of the PSA and so on. I don't want to go into detail of what is written in the books. I'll tell you a few things, and please believe me, you will benefit from it. I believe any man, and listen to this carefully, please. Maybe many of my colleagues are against my comments, but I can answer anyone anyway. Any man above 40, anytime you go for any type of blood collection, ask for one PSA as well. Clear enough, right? Why I'm saying this guideline says, do PSA when you are 50. Do PSA if your family history is positive. Do PSA for, come on man. Very simple. Any man above 40, you will get blood test. Ask the doctor to add PSA. But please don't do this every 3 months or every 6 months.
So PSA is a blood test?
It's a blood test. Exactly. So far clear, right? What I said? Now, if your first PSA, the first PSA that you detect at the age of 40, will be less than 1, it is very unlikely to have prostate cancer in your life. So for the following 5 years, don't repeat PSA. A lot of patients again ask me, how often we have to repeat? It's, you know, like if, okay, I'm afraid Dr. Fayed was explaining to us about prostate cancer, so we have to do it every month. No. If the first PSA at the age of 40 will be below 40, below 1, don't do it for 5 years. If it's between 1 to 2, okay, do it after 2 or 3 years. If it's above 2, go and see your urologist. Very simple. Clear? Video number? You can find it. Clear, right? It's clear? Yes? Again, what to do, how to prevent. Many patients ask, you know, a lot of patients come, doctor, I have this medication, maybe I'm talking against also person scientific, I don't know whether you have any medication for prostate enlargement or prostate cancer or whatever, you know, but there is no treatment, no prevention that is really established. We can tell you, yes, take this medication and you will not get prostate cancer. That's not true. Again, in general, we can tell you, yes, please eat antioxidants, do exercises, you know, do more sexual activities. All of these can help, but it cannot be prevented. Okay? So early detection of disease is the solution, and how to do that, the way that I mentioned, and this is the way. And then avoid embarrassment. Again, a lot of patients also, you know, when we ask them to do DRE, digital rectal examination, they don't accept, and seek doctor in time. If your PSA is, you know, I have patients, very VIP patients, whose PSA is, you know, high, but they don't want to accept it. You know, no, I'm okay, I'm fine. See, the difference between prostate cancer and many other cancers, like for example pancreas or stomach cancer, is that pancreas or stomach cancer can kill very soon. Prostate cancer, you may have it for years, maybe 10 and 15 years, and it doesn't cause any problem. And this is the reason why we say, if the life expectancy, you know what is life expectancy, right? If the life expectancy of the man is less than 10 or 15 years, don't do PSA screening. Don't worry about it. Clear? And this is the reason why when 80-year-old man comes to us, even we don't do PSA. There is no reason to do it. Clear, yeah, what I want to say? Okay. And for diagnosis, we do prostate biopsy. I think these are too detailed. We don't have to go into it. And then we can remove the prostate, radiotherapy, and many other things, which is also not important. There were some famous people with prostate cancer, and these are all famous people. Most of you know this, that all of these have prostate cancer, and the reason why the pictures are here, because they announced this in the websites or the internet, and one of them is my father as well. He had prostate cancer, and alhamdulillah, we operated him in 2007 in Austria and Linz, and he's fine, alhamdulillah. And I was the operator here, as you see. And some famous people who died from prostate cancer, also you can see here, so there is no mercy for prostate cancer. So all of these people that you see, most of them you know probably, correct, Dr. Ilham? They died because of prostate cancer. So if it is not diagnosed in time, not treated in time, it can. Clear? Take home message, right? So, a few more words about, we will discuss about, we said that November, we don't want to talk only about the prostate cancer, but in general, men's well-being. What is men's well-being in general? It is a physical well-being, and mental well-being, emotional well-being, and social well-being in men, which is also important, right? All of these are important. How prostate disease can influence all of these things that we discussed. I don't want to go into detail on the literatures. These slides I have arranged for the general physicians, for the GPs, and for the family physicians. I don't want to go into detail, just I would like to highlight that what I'm talking are based on a lot of established literature, a lot of articles that we have in the publications. And it is important that males with higher severity of voiding symptoms have more sexual function problems. So those who have voiding symptoms, those men who have either prostatitis or enlarged prostate, which is causing symptoms, they may have also sexual dysfunction. Like what? Like, for example, erectile dysfunction. So a patient may have chronic erectile dysfunction, which means that, what does it mean, erectile dysfunction? There is no enough erection which can initiate or maintain during sexual activity, and that can be a disaster for the couple. And these people have treatment, and a lot of them, 30%, may have some problems in the prostate. Premature ejaculation, what does it mean, premature ejaculation? If a man ejaculates within 1, maximum 2 minutes of the penetration, that means that there is premature ejaculation, and this also can cause a lot of problems for both men and women, and there is solution for it. Chronic prostatitis, we discussed about it. It's not working? Yeah, what up? You freeze? Chronic prostatitis, we discussed about it, and it's important also, I would like to highlight that when you have any type of, when a man has any type of prostate issues or men's issues that I mentioned now, including BPH, prostatitis, erectile dysfunction, premature ejaculation, it will have negative impact on the woman as well, and in his job as well. And there are a lot of publications in this regard, and it can cause also depression, anxiety, and stress as well. And so all of these are the problems that prostate issues can cause. So I would like all of you to have, actually men, when I say this, my son is living in Los Angeles, and in one of the videos I said that only men have prostate. And then he told me, Dad, don't say this. Here in Los Angeles, come on, wherever you are a human being, and only men has prostate cancer, prostate. Women don't have prostate. Okay, and this is true. So whether they change their gender or not, still genetically they are men and there is no prostate. You understand my point, yeah? So we'll discuss about the questions, if there's any questions, and again, thank you very much for your attention, contribution, and for following me in one of my sites. I have website, I have Instagram, and also I think I have also YouTube. I have few more questions here which I didn't give it to you. So the last thing that we'll do here now, I don't have the numbers, so tell me.
Ask one question and give all what is in your pocket.
In my pocket. Okay. But give back to me, please. Okay. So ask one question. My question is: did you learn anything?
Yes.
Did you learn anything? Did you?
No.
Sorry?
No.
Who doesn't have? You don't have. You didn't learn anything. Was it useful? You have already. Okay, no problem. Okay? Who doesn't have? You don't have? You don't have? Okay.
What
Who
did you
doesn't
learn
have?
today?
So please give it back to Dr. Ilham, okay? Or Dr. Fardeen, please. You have? Okay. So, now from number 1 to 20, who is the youngest person here? Okay. Okay. He doesn't have any number. From number 1 to 20, say one number, please.
13.
My God. Who is 13? So here 13 is...
Oh my God.
So, you are the second winner. Thank you very much for your contribution. Thank you. MashaAllah. MashaAllah. So one small book, which is one of my favorite books. So read it, please, and also announce it to the others. And they can read it as well. Thank you very much. If there's any question, we can discuss.
Thank you so much. Thank you very much for an enlightening presentation. Really, we really enjoyed it. I hope you did too. Anyone has any questions for Dr. Fandros? If you have any questions, we'll be happy to answer.
I have a small question for you. So, you
Small
said,
question, how small?
I'm useful.
So you said you should drink enough water per day. What is the quantity which is in your consideration considered enough?
Very good question. Really, believe it or not, again, I'm not talking because of the advertisement, but honestly speaking, nowadays I'm using my website and Instagram as a brochure of urology. You know, go to video number 23. And what I say there is very nice formula. Consider your weight. Let's consider your weight is 90 kilograms. Divided by 30, suppose.
30.
That is the amount of liters of water that you have to drink.
30 liters per day?
No, divided by 30. Consider your weight. Divided by 30. Divided by 30, that is the minimum amount of water that you should drink, right? Because a lot of patients ask this question, and you know, we usually say, drink 3 liters. But why a 30 kilogram woman should drink 3 liters and 200 kilograms should drink 3 liters? It's different, yeah? So this formula, remember, your weight divided by 30 amount of liters of water.
I asked this question, but you took the mic. So I have a second question.
Please.
So honestly, from my side, I barely can drink 2 liters, 2.2 liters per day. I do sports.
Yeah?
And I do sports. And 2.2 is less than the formula you gave. Are there any kind of
Videos that you can drink more water.
Yeah, this was a very good
Drink more
question. See, find a way. You know, of course, there are some people who cannot drink more water, as he mentioned also. But find a way. Add some lemons. You know, add some fluids, or you know, find a way to drink more water. For example, you said that I'm doing a sport. If you do a sport, you have to add half liter. If you do sport more than 30 minutes, any type of sport, more than 30 minutes per day, you have to add 3 liters. Or otherwise, you do good business for us because you will have kidney stones.
The best way to increase the water consumption, always keep a bottle of water next to you.
No, he said I cannot drink.
No, you can, but he
And
forgets.
type of drink is also important. Forgets is different. Forget,
Alzheimer pills
will may help, yeah, that is different. But if you cannot, find a way how to drink. And there are different types of water. You know, you should find a nice type of water. For example, X water, you may be able to drink only 1 liter per day, but another water type also depends, you know. Because a lot of patients ask, does it matter which one for the stones? No, drink whatever, but drink something that you can't drink even.
Guys, keep reminding me.
Sorry, I have a question.
Please, please.
So, as you can see, I'm a bodybuilder.
Much.
So I take creatine and protein. So, I'm hypertensive patient, so I take 3 medications per day. So what do you recommend to do? And what would be the effect of creatine on kidneys, for example?
Usually we have a lot of patients who go to gym, and who eat a lot of supplements, and also my personal opinion, don't eat anything unnecessary. It doesn't, your body doesn't deserve. You want to make muscles, but you make something else problematic. I don't recommend to, unless if you're making money because out of this, unless if you want to do this because that's different. We cannot stop you, but only because it's your hobby. Stop taking anything unnecessary. Anything.
No, I'm saving my marriage, to be honest. So the thing but I drink a lot of water. So like I drink 4 or 5 liters.
Yeah, but you're eating creatinine and you're eating supplements.
Creatine.
No, so creatine and protein. Because my food
Intake is less than.
intake is less than what I need per day from protein perspective.
I always think this is again my expert opinion. Okay, before 100, 200 years, we didn't have all of these things, and people were living. How they were living with the things that we have on the earth. So there are a lot of things, vegetables, fruits, meat, and a lot of things that you can replace. No need to depend on these medications because of this reason that we mentioned. I do not support, but choice is yours.
He has muscles and he wants to grow.
Yeah. Something for
Famous
something.
people are.
Something for something. Exactly. Yeah.
حياة الجاكة صعبة.
كيف بدي أقولها؟
Thank you so much, Dr.
Thank you.
Fairuz.
Thank you.
Thank you so much, and thank you for attendance and answers.
Thank you.
Please remember,